Tonight, there is a growing push to try and stop Scripps Mercy Hospital in Chula Vista from closing its maternity ward. Good evening, and thank you for joining us. I'm Kirsten Holmes. Medical professionals rallied earlier today to protest the planned closure, which they say put people's safety at risk. CBS 8's Rosia joins us from Scripps Hospital in Hillcrest with more details. Tell us more, Rosia.
Yeah, well, local workers worry that this closure harms mothers and their babies in underserved areas of the South Bay by forcing them to go further away to seek care. But Scripps says that this will help the hospital meet the rising number of emergency room patients that they're seeing.
Shame on Scripps! Shame on Scripps!
Dozens of doctors, nurses, advocates, and patients stood side by side to protest the closure of Scripps Mercy Hospital's maternity ward unit in Chula Vista.
We hope that they could reconsider taking away care from a really vulnerable population that needs that labor and delivery care.
Everybody will be at risk.
The protest took place at the Dell, where tonight Scripps held their sold-out 50th annual ball that draws in donors every year. Workers say they decided to protest here because they wanted to bring what they say is the risk and inequity of this closure to the attention of donors.
Right now, what Scripps is doing is taking away care from the most vulnerable.
Scripps says it's moving its labor and delivery operations in Chula Vista 12 miles north to Hillcrest to help alleviate Chula Vista's crowded emergency department. In a statement, the hospital says the process for this transition includes a 90-day regulatory notice period, which began last month and is expected to run through approximately mid-June. Women with planned deliveries at Mercy Chula Vista in that time frame will still be able to deliver there, but workers worry the closure could have deadly consequences.
As a physician in the South Bay, I'm with these patients day in, day out. I fear that there's going to be a lot of confusion, a lot of maternal death, a lot of fetal bad outcomes.
This closure means that those families are lost. They probably do not even know where to go.
Some believe the move only hurts people in underserved communities.
And I think this is being done particularly there because they feel like no one will ever say anything about it. I believe that Scripps would never do this in a place like La Jolla.
Now, last month, local doctors called on the California Department of Public Health to investigate this issue. And currently, there is a bill by Assemblymember Akilah Weber that aims to help maternity wards before that point, reaching that point of closure. That bill passed out of the Assembly Health Committee last week and is now heading into the Appropriations Committee. In Hillcrest, Rosia, CBS 8.